Hello, everybody. Welcome or welcome back. This is the third interview with Dr. Dopplinger in our weight loss series. Dr. Dopplinger is the medical director of the Tamina Health Resort in Bad Ragaz. Dr. Dopplinger, thank you for taking the time and thank you for answering a few more questions. I'll promise this is the last. We have been talking for way too long, but simply because it's so interesting to talk with you. So we're talking about weight loss and weight loss programs at the Tamina Health Center. And one of the things that I would like to know is the medical assessments you do at the beginning of a weight loss program and what you use them for.
So our medical checkup in the beginning is also very personalized and intense. So of course we start with lab tests because if we see in the lab that in the blood work that there are any problems that are slowing down weight loss, a lot of people, especially women, for example, they are fighting their hormonal system, not even knowing that they are fighting their hormonal system. So that's why we decided in the beginning to have a full blood test to see where we are now. We check the liver, we check the kidney, we check the blood sugar, as I mentioned, we check the thyroid, for example, we check the blood cells, we check the urine to see where we are and if everything is medically correct. And if we see a medical problem, maybe it's not the right timing to start a weight loss as well. So what we do as well is we do an InBody measurement, a body composition, to understand how the body proportions are, how much muscle mass do you have, what is the goal as well, how high is the body fat percentage, and one of the things we are checking as well is the visceral fat. The visceral fat is the fat around the inner organs. It can be connected to cardiovascular problems or the onset of diabetes. And with weight loss, of course, you can reduce the visceral fat, meaning you can reduce the risk for a heart attack or a stroke as well. That's why we take these numbers in the beginning as well. What we do too is a cardio-metabolic testing to see how good your VO2 max is. VO2 max is a measurement for how good your muscles are absorbing the oxygen when you are doing sports, to see where you are there. And based on that, we can give you personalized training recommendations. So we can give you the zones, the ranges for your heart rate you need to do training to get the maximum out of your training. So if you start training, of course, you start with a lower heart rate, for example, between 100 and 120. But if you are already in training and you want to lose some weight, then the zones are changing. Then you train with a higher heart rate. But we give you the exact training range for your heart rate so you can focus on that. A lot of our guests, they have a personal trainer. They do cardio training at home or weight training. So they can, even there, they can do the little twitches to get the maximum out when they go back home.
And how long does that usually take, all these assessments? Is that 1 day, 2 days, 3 days?
Normally we spread it over 2 days because you see the doctor as well, you see the nutritionist, you go to the cardio-metabolic lab, you do the InBody measurement, we do the lab work, and based on that, if we need something extra, if we find any issues, then of course we can offer further testing due to the fact that we have a full laboratory in-house and the radiology. So if we need a full body MRI, we can have it the next day, which is no problem. Therefore, based on that, we can also specify if more diagnostic is needed. That's why we do it in the beginning, yes.
Cool. I didn't know. Although I've been visiting your resort a couple of times.
You have to come back.
Okay. Yeah, I didn't know about the MRI, for example, which I mean also indicates quite heavily that, I mean, this is also for me always a big differentiator to other, let's say, medical wellness spas, is that you have a strong medical side. No, that's what I know.
Yes.
Didn't know about the specifics that there is a MRI and so on, but I think you even have a medical license, no? Like a health
Yes,
license.
yes, we do. Yes. Yeah. So everything we have
Which
a lot
I think is quite unique. I don't know of any.
Yes, compared to the competitors, that's one of our outstanding extras we are offering. That we have a lot of medical knowledge on site, and we have a big network of corporations. So we don't have a cardiologist here, but if I need one, I can have one tomorrow. So this is all organized in a setting. Yes.
Okay. Well, no more questions because you have been touching all my points. Maybe one more. So let's say I would book now a medical program with you, because I assume this is something that potential clients of yours could be interested in. So I book my stay with you, and my first 2 days is just examinations, or do I start with the training right away?
Yes, you start with the training right away because, as I said, we want to create a good habit. It needs time. Therefore, we start with training in the beginning. The programs we are offering at the moment is a 7 and a 13-day program, but knowing some of our guests, they come for 10 days or 21 days. So we also can individualize depending on your needs and how much time you actually have to be here on site. We can tailor the program to the length of your stay as required.
Dr. Dopplinger, thank you so much. I know it's been long, probably longer than we both thought, but I really appreciate taking the time. And at the users, if you have any questions, please feel free to send them to us or directly to the Tamina Health Center. I'm sure they will be answered. Thank you so much, Dr. Dopplinger.
Thank you.